Joining us now for more is Dr. Steve Flindall, ER doctor in Ontario. Dr. Flindall, a pleasure to have you on the program. I want to get your reaction to what the health minister said there. Tell us a bit more about the cases that you're seeing in the ER, first of all, and whether or not she has a point. Should there be sort of I guess, a triaging happening before people go to the ER?
Well, I don't think she understands how quickly these children get sick. And I don't care. You could be the best family physician in the province. If you've got a child that's extremely sick with RSV, there's nothing you're going to be able to do for them in your office. These are kids that require really advanced life support in some cases, and that's just not available to a family doctor in their office. These kids are sick beyond what most people will ever experience in their lives. And to say that the family doctor should be seeing more of them in their office is completely deluded.
So talk to us a little bit more then about what you are seeing in your emergency room. We are hearing about emergency rooms across Ontario that are over capacity. What is the situation there?
Yeah, it's just huge numbers of patients coming in. It's really quite stunning to see the number of pediatric cases coming in. And when I say pediatric, I don't mean just like, oh, technically they're under 18. I mean, these are young kids, a lot of them under 5 years old. And they're coming in quite sick. And it's nothing that a family doctor can do. These kids are getting sick, and they're getting sick quite quickly in a lot of cases. And there's no intervening on it. Either they've had their vaccinations or they haven't. And if they haven't had their vaccines and they get sick quickly, there's nothing a family doctor can do to prevent them from coming to the emergency department.
So then what kind of cases are you seeing? Is it COVID-19? Is it RSV? Is it flu? Is there something else?
It's all three. And, I've had some pretty sick kids with RSV. I am really surprised, though, how sick the kids with influenza are. Almost to a patient, the ones that I've been worried about and like actively resuscitating as soon as I see them have turned out to have influenza A. So if any parents are kind of on the fence whether they should get their kids vaccinated for flu this year, I would really encourage them to do so.
Mm-hmm. And so let's talk a little bit more about prevention and what can be done in order to help prevent the spread of flu, of other respiratory illnesses right now. What you want to see more people doing at this point?
I mean, the quickest, simplest, most effective thing we have right now is put on a mask. If you're out in a public space, put a mask on. If your kids are sick or showing any signs of respiratory symptoms or GI symptoms, keep them home. Don't send them into the school where they're going to give it to other susceptible children. Please get your kids vaccinated. Avoid going to large gatherings that you don't necessarily have to, especially if there are vulnerable people there. Try to get up to date with your COVID shots.
Okay, Dr. Flindall, a pleasure to have you on the program today. Thank you so much for taking the time. We know how busy you are.
Thank you.